get started, I need to give a bit of a disclaimer here. What you will see and hear about today is written in the literature in a lot of different places. However, it is my spin on it. That's the right I get today. The final talk, all right? Yeah, like who's gonna fire me at this point? So I just say there is a spin on it, believe what you want, but take something out of the room on what applies to the work you do or that you hope to do. Do we have many students here? Oh, quite a few, okay. Well, I should have adjusted this, but okay. Okay, so this is the overview, and again, I looked at so many definitions of university community engagement, and Lena, where are you? You will vouch for us that there's a lot out there. So again, you'll get my spin on what that is. The general history could be picked up at any point, and you'll see where I picked it up on, and then you'll hear my view of how OCD started. It's a good thing Bob McCall is on a beach somewhere in Florida, because, although Carl's here to listen. Okay, but I'll get to Carl's role also. And then lessons learned in two areas, operations and scholarship. Challenges, I could have went on and on and on, but then, yeah, you don't want to hear all of it, but I picked a few. And the impact. The impact's my favorite part because it doesn't get accounted for in scholarship, it doesn't help move towards tenure, and yet it saves lives and it improves lives. So those of you who have any authority here to make changes in that kind of thinking, please consider that. All right, before I get started, I want you to understand that I see university community engagement as attitude, process, and outcome. You won't find this definition anywhere. A lot of this stuff, by the way, that is in this presentation is just last week or week before we found out is in press in the Journal of Higher Education Outreach and Engagement. Right? Yeah. So you will hear some of these, but I wanted you to see that you won't get out of this room today without meeting my new coaches, my grandchildren. And who could have a better attitude than what you see on this face, right? But I will return to attitude, process, and outcome because this is what I see and I believe is embodied at the Office of Child Development, which I may refer to as OCD, and those of you in psychology don't go there. It is the Office of Child Development. So attitude, process, and outcome is really driven by equal partnerships. You're not going to see them in every slide. But any opportunity I've got to use them. Okay, so she's the second oldest, Mia, and the third oldest or second youngest, Madeline. Okay, so they have an equal partnership in many ways. As they get older, we lose some of that, but we don't want to lose that in university community collaborations. That's really very important to maintain, and that is what drives successful programs, I do believe. All right, so now, where do we decide general history starts from? I picked in the 70s where the senator, good Senator Proxmire, was sending out Golden Fleece Awards. They were for a variety of things. He felt he was the taxpayers' watchdog, and that taxpayers deserve more from academics. And there were things like the Department of Education was putting out a curriculum as to how to teach college students to watch TV. He made public what was going on in the Department of Justice when they were looking at why do prisoners want to escape? And he looked at the Department of Defense and he's saying, okay, now we're looking at to why the military or whether or not the military should carry umbrellas. So, okay, I'm not going to go through all the reasons, and I didn't read all those studies, but then there were things where he actually got sued by a researcher because this researcher was looking at why rats, monkeys, and humans clenched their jaws. And he made a big to-do about it. The researcher demonstrated that he was looking at causes and symptoms of aggression, and it was very important. So whether or not Proxmire was right or wrong, the point here is that it turned a lot of thinking around in higher education and in the Academe. And what happened then was a response by many to start thinking about what was out in the community and what was important to study. So there were basically two different ways of looking at it back then in the 70s. And one was top-down, the other was bottom-up. Some institutions decided to put in policies and to encourage faculty and others to study these compelling social issues. Other institutions did not, and it came from bottom-up. And this came from units, it came from individual people, and it was very important as well. As far as I know, that was a while later, I entered the University of Pittsburgh, and we were quite a bit behind. It was just not happening here. And so there were some people who had tried it, and for reasons that I'll go into later, it did not work that well. And what happened then, maybe a decade or so later, is this. Those of you who know this group will say, boy, that in 30 years. And this is the group of pioneers, and there's Bob McCall, myself, and Kathy Rudy, who's sitting up here with her lovely husband, Denny, she was critical in getting a lot of our programs started, and then started getting her own programs, so she didn't assist us as much as we wanted, because she was on her own and going for a lot of stuff, kicked off fatherhood issues and international work and other things. So what this was a bottom-up effort to see that social issues were addressed. The bottom-up effort was started by Carl Johnson, who's sitting in the second row, and is from our own ADP, and Mark Strauss, who's from psychology and was unable to come today. But they got together, got a hold of foundations in town, Buell and Hines, and got it funded. He said there's and I'll put words into your mouth. They said there's so many efforts out there in this university to address the issues around children, youth, and families. Why not pull them together? Outside of the university, there's so many efforts to address issues of children, youth, and families. Why not work together? So this was the birth of the Office of Child Development. We were to be and are still an all-campus unit, but I'll describe how that evolved. And we were to facilitate. We were to convene groups who are interested in the same goals and the same topics. Well, facilitation gradually moved to operations. Independent convening, we would get together, pull groups together, and I'll show you a few of those, and then get money. And then there was no one to run it. And then they'd say, we have turf issues going on here, but you were unbiased and you were credible as a convener and a grant writer. Would you run it? And slowly that happened. And at the end of this presentation, that human impact is unbelievable. The numbers, the types of programs we have. So, back to attitude, process, and outcomes. I do believe that this conceptual model is what drives the Office of Child Development. Without the belief and value of respect for scholarship and for community issues, and that positive attitude I showed you at the beginning, we would not be as successful as we are. Without a process that is community driven, and I'll show you how most do it kind of the opposite, and using academic values, that we would not get to the outcomes that we all agree on with the mutual goal of improving lives. So this, I believe, drives the Office of Child Development, but to make it work, we had to have an environment that would facilitate these values. Do you want to come over? You can walk, keep walking. Julia, Ed, they've been my supporters as well. Okay. So the infrastructure, the environment I'm talking about that supports these values is this. And we used to call it the atom bomb. We used to call it the petals of a flower. So I'm not sure what it is. But to start up here, actually, when a grant or a request comes into the Office of Child Development, it could start anywhere, and it has. We ideally love it to start here, and if it starts in one of the other petals, we bring it back to here. And that is because, as I said, academic values and scholarship are critical to making us different from other community agencies, from other units. So no matter where the request comes in for whatever community need, we go back to what does the research and literature tell us? From locally, from domestic, from international work, what does this tell us? If it's not there, we then produce our own. So we look at what's out there and or we generate our own. It might be a needs assessment. It might be logic modeling. It might be focus groups, but we try to go back to this. When we go into services, we want to see it as a pilot, a demonstration based on what we have found here. And in the middle, it is always for the goal of improving the lives of children and families. Once the services have been tried on the ground, yes, our students, our GSRs and GREs and everything else, all the Gs, are out in the community, but the people that are going to implement this are the ones that we are most concerned with and want to work most closely with so that when we leave, it continues. As the services are going on based on the scholarship, we are evaluating and monitoring, learning from the work, and then getting the information out and disseminating it so that the work is improved and that we could have new policies if there are lessons there to be learned. So that is how we move through. Here's the conducting a demonstration pilot, and here's learning and the change and disseminations. This, I don't expect you to see it or to really be concerned about it. Let me get on this side. But this is our timeline from 1986 when we were established for the first 25 years. This is important for anyone here who's interested in, so how do I do this? And how do other institutions do this? Well, you can see some activity here that I am going to describe in detail later. But this was all, sorry, the color didn't come out either. Innovating and service demonstration. As we started, that's where our forte was. So that's the direction we went. But we went in that direction because we had a lot of champions who came to us and asked us to. Once we realized we were successful here, and we were learning from what we were doing in research and education, we began to pick up different kinds of projects and applying them to policy and practice. So you could see here there's things like the Alliance for... The Alliance for Infants, and we have some people here representing that community group that I'll point out later when I go into a little more detail. And Healthy Start, that people don't even know, started at the Office of Child Development. We went on to after-school programs and youth crime prevention. People think that the Office of Child Development is only young children. We do homeless work, we did smoke-free environment, policy work, and then international orphanage work as well. You can see in these middle years, there's a lot of activity going on. Where the lines continue, those projects have continued. Remember, we were supposed to facilitate and then kind of divest those projects. It didn't always happen that way. So I just want to, so that I wake up some people here, I want to give a tribute to our staff people. So I ask those of you who have either worked with OCD, in OCD, or are currently staff and faculty at OCD, at least raise your hand, wave it around there. Most of the room, thank you, thank you, thank you. This is what has gotten us 31 years of success. It's the people in the room, and I do want to thank you so much for giving me the best job I could have ever dreamt of. And I tell you, I do wake up. Even if I'm on vacation, I wake up and I laugh. Sometimes in my sleep, Brian, don't go there. Yes, it's just a wonderful, wonderful career, and I thank you all for making it so easy. But for the last 15 years, we really stabilized. As you know, there was Bob McCall and myself, and we had a secretary early on. We started with $200,000 from Buell and Hines, and Bob's salary at that time was the only thing from the university, but we did have office space. If I turned around, I banged into the wall, and I had no windows, still have no windows. It's only 31 years, but that's okay. But now, over the last 15 years, we have stabilized. We're at 40 to 60 staff people, and I will talk a bit about why that's important. They are staff people, and only the university cares if they're faculty or staff. Our staff people do what most faculty do in other institutions and in this institution, and I'll talk about that. So, we have fabulous staff. Why do I get to that? Oh, oops. Where? There, sorry. So we have fabulous staff people, and we have typically 10 to 20 students, mostly graduate students, from several universities. Remember, we were to be campus-wide, but we were also to facilitate collaborations across campuses. So we do get a lot of Carlow students, Duquesne students, and many others, and from international institutions as well. We have had, for the past 15 years, about $8 million a year. And that's important when I start to talk about core funding and how to look at our finances. Off campus, and yes, in a basement, but we love our basement, and it's 16,000 square feet, so it's very difficult to get on campus and to get into another facility. Now I bring this up only because it's important to start to understand categories of programs we have. So until recently, you know, Bob McCall was here along with me as co-director. Originally, we started in the provost office. That was important in our back history because we wanted to be seen as an all-campus facility and work across campus, not being aligned with any one discipline, not being aligned with any one school or program. And so being with the provost, that was important and helpful. The provost, and this is back about 3 provosts ago, every decade or so. But anyway, back then they decided they were going to divest programs out of the provost office. We had to go somewhere else, and I won't go into the history of how we went to one and another, and then found a friendly home here at the School of Education when Alan Lesko was starting as dean. At that time, Jim Marr was provost, and the 3 of us talked, and it was important that the timing was okay. We were already known. We had a reputation within the university and outside of the university, so there was less chance, but probably still happened, that we would be confused as being only education. As a matter of fact, we had a policy at the beginning never to go into schools. So what we thought of as education and after-school programs and mental health issues and homelessness and teen pregnancy, that was all related to education in one way or another in a broad sense. So that's why I bring this up. That was important. And then when Valerie came, and yes, she's right. In November, when we left the room, we cheered. She's got to be the one. She's got to be the one. And then when I spoke with the provost and we were talking, I think I told you this one, the provost and Bob and I were resigning, and I said to the provost, she said to me, what are you going to look for in your replacement? And I said, I don't know now. You stole the one person we thought could do this. And that was Valerie. Valerie wasn't here yet, but she had been announced. So we're very excited to have Valerie. Valerie has already advocated for us so much and supported us. And that is why we're in here. And what is important down here, you can see John's name here and Shannon, who is taking up the reins on our research and evaluation and other work in this. So to understand, here we have programs, we have Colleen in the room and many others that I will start showing as we get into the programs, and this part is our evaluation and research. All right, so how are we different from other university centers? We did a survey years ago with other university centers who had claimed to be university community engagement centers, although they used a different term back then, collaborative centers and other things like that. It was with about a dozen or more, and we asked a lot of questions to find out how can we improve? How are we different? And what we found is this, that we are mostly grant funded, 95%. There is no other unit like that we could find. It's the opposite. Most units are almost totally university funded. And then if they happen to get a research grant in the director's interest area, or one person comes in and another faculty member gets another grant, fine, and they do that separate. It is not funding the collaboration. We have a broad content domain, children, youth, and families. That broad content domain is good and it's bad. It's good in terms that we can see what is the need in the community, and we can be flexible, and as some people call opportunistic, if money goes with it. Nimble is maybe a better way of saying it. The bad part of it is that it's confusing. People say, oh, you're early childhood. No, not just early childhood. Oh, you do program. No, we do evaluation and research. Oh, you do family support. No, we do orphanage work. So that gets us in trouble at times, right there. We are community driven. The other institutions none of them were community driven. They were not driven by the needs of the community. They are and were driven by what their interests, academic interests were. So if you're doing research on one area of psychological issues or mental health, then you go into community and find a partner that's relevant. We are community driven, meaning that the community comes to us, or we sit on community committees, task forces, advisory boards. We listen to the needs of the community. Then we work with them to develop solutions to those, and then we proactively try to go get money. Or we find where the money is and see from our knowledge base of staff sitting on these different boards, is this something this community needs? If so, let's see if they want it. and we pull them together, and we go after in partnership. We go after that kind of work. Okay, so we only have 2 to 3 faculty positions. As I gave you a teaser before, means nothing. People say, how did you get $250 million, not million, $1 billion with only 2 faculty? What? We have 60 people working on this. Doesn't matter what they are or are not. So those of you in the room probably are going to dislike me for a long time, but that distinction is not important in doing the work OCD does. It is in other areas. It is not important to us. We don't even, if you look at any of our documents, we don't use, you don't know who has a doctorate, who has a master's, who did not get out of school. It doesn't matter if they have the skills to do the work. So the staff, as I said before, they lead projects, they write projects, they get them funded, they make it work. They can get into areas that other people cannot get into. Neighborhoods, outreach. They are listened to and respected by those constituents that we want to work with. And so, you'll see later, we hire a variety of staff. Okay, so the lessons learned, and there's Carl. 30 years ago, Mark Strauss, Bob McCall, our first secretary, Judy, and me. And so I have divided up the lessons learned into operations and scholarship. And we used to have a good time. All right, the first lesson learned is that you need balanced leadership. 30 years ago, applied work was not that popular. So there was a need to have somebody who, as Bob calls, blows the academic smoke over our work. So we could do what we really wanted to do, what we thought was important to do. What we learned, the lesson we learned on that balanced leadership, is that you have to have somebody who's full-time. You don't have to have 2 somebodies. You have to have a somebody who is dedicated to this work, who does not walk in with their own research agenda, because then we learned from others, the surveys we did, that we give this talk, not this particular one, but we talk about university community engagement all around the world. We're on panels with chancellors and vice chancellors and provosts who do this kind of work, so we learn from them. So just to give you some credibility, it's not just my side of things. We know that somebody has to be full-time at this, or it will be at the bottom of what they go for and what they work on. And it's not to say that eventually Bob and I did not get a research agenda. You know we did, you know the orphanage work, but it was something community-driven. It came to us. We used to talk about, geez, I don't know a thing about an orphan. I've never met one that I know of. And yet, we got into it, and now we're known around the world for it as an office. What else is important is core funding. All right, so in core funding, what it does, it lets us take a lot of risks. And I'm not just saying all the times I was called into the university council office, or all the times that I got a call from the provost's office for something we weren't doing quite the way we should have. And those were risks, yes, but we could risk going after grants and projects that typically a traditional unit would not go after. So that was very important for us. We had to be able to explore with the community. And if they said, yeah, this is what we really need, we say, oh, that's not what an academic unit would do. That's not what I see as community engagement. So core funding, and to the tune of our $8 million per year, was approximately $100,000 a year. What is that? Well, I didn't figure out the percentage, but it's quite low. But it gave you psychological safety right, Shannon? There we go. We need psychological safety to explore, to take risks, and to do the unusual. So that's very important. I have to say, in that $8 million is a big university contribution in terms of parts of my salary and Bob's salary, and $20,000, I think, is the other part. So in the $8 million, that's important, and we have learned other ways of accomplishing core funding without direct support, in addition to that $100,000, and I'll talk about that in a minute. Okay, so core funding leads into no quid pro quos because at the very beginning, the community as well as academic faculty and others would say, so what do you get out of this? They're skeptical. And 30 years ago, the University of Pittsburgh was not even allowed in certain neighborhoods because things had gone really badly years before. So when we started, we didn't say we were the University of Pittsburgh, and we did have to have people who were trusted in the community. So we could also say, we don't need the money from what we're doing here. We don't need to publish. That's not what we're here for. So that was very important, and core funding allowed for that. The flexibility, I've talked a bit about how flexible we could go, but you had to be flexible. The players are changing constantly. Community priorities are changing constantly. Now, especially with retirements, they're changing constantly. Oh, and here's a fella who has changed everything. Bob McCauley, Bob Nelkin, sorry, I'm referring to him, but Bob Nelkin, head of United Way. So, and an OCDer for 11 years. Thank you. I've thanked OCDers for what's going on. Okay, respect for deadlines. This is important, and especially early on, we did not get that feeling from faculty. Not any academic value to the degree it is now. So anyone in this room is not part of what I'm talking about. But deadlines were critical for what we were doing, especially in policy work. So if we told the governor or the mayor that we would have a report to them on a certain day, they often would have the media waiting. There would be a conference. There would be a piece in the newspaper. And if we did not get them the advanced information ahead of time and talk about, well, this didn't go quite the way you thought, those numbers aren't right there, so let's come up with a solution, because that when the journalists come in, you have a way, oh yeah, we knew that wasn't quite right, and this is what we're planning to do. Well, if you don't do that on a deadline, you're not going to have their trust and respect, and you're not going to go get further funding in the future. So you lose them as a partner. Funding for special projects. You could see in this is an example year, I believe it's probably fiscal year 15-16, but it shifts its lines a bit, but you see the federal, state, and county are the largest part of this pie of the 8 million, and private and university are smaller. But special funding does not happen in a university community engagement center without champions. There's people like the Bob Nelkins of the world and others who were in government who would remember us, who had worked with us, trusted us, we had a relationship with them, and something would pop up and they say, yes, I know a place that might do that. Let's see. It was very important to have those relationships, and as I said before, it was those task forces, committees, and other groups that we sat in on that at first you say, wow, that's not being paid for. Why am I doing this? But we had to do that. We had to understand and keep our ear to the ground as to what was important in the community. All right, the other lessons learned from operations is that domains of projects are important, but as I described before, our broad domains does cause some confusion. But we were interdisciplinary education and training, interdisciplinary research, evaluation, and policy work, and service demonstrations. These were important to us. Those were the domains. And then with that broad outcome goal that was in our circle before of improving the lives of children and families, you put that together, the opportunities were enormous. Useful services, so that we would be asked to do more work in the future. We try to keep with the community's interest, and whether it was through newsletters, news that you can use, we used to say, or writing, and here's the John King that was on the table of organization, and I'm going to be introducing everyone as anyway. So useful services have always been important. Convening groups when they want to be convened around a particular topic, not things that were interest to OCD only, but those that would be helpful in the community. And back to my issue and my thing about staff. Staff, in addition to being able to do things faculty could not do, staff were flexible. Once we hired staff, there's ownership to the responsibilities they're hired for. There is a dedication to getting that project accomplished. They could be fast-paced. They could drop things in one project and move on to another if necessary. So it was very important early on for us to have capable and good staff. Now I say, it sounds like all was wonderful. We were good at this kind of stuff that you've heard so far. What we were not good at and are not good at is the in-reach that we were talking about at the introduction. We still, until today, have trouble getting faculty engaged in a lot of our work. And I will be talking about that, and anyone who has ideas on how to improve that, we're very open to hearing it. Oh, did I show you our Lori here? And there's Mark Turner and Julia. Do you see yourself there? Oh. Okay, and there's a vice chancellor and others in there, and Marge is in there as well. Okay, so the lessons learned in scholarship. So those are all the lessons learned in operations. Lessons learned in scholarship were a bit different, and this is where we were challenged a bit more. Over the years we got better at it, but we're still not there. Service learning is not the typical service learning of interns and practica that students are more accustomed to. We really need the brightest and the best. We need people who could look at theory, understand it, and apply it to community issues. In return, through service learning, our students do publish. They occasionally travel internationally with us. They do data analysis. They get their own projects by the end of the year that they manage and write reports on and present those findings. So it's usually a wonderful placement, biased a little bit. Okay, engaging faculty, again, that is difficult. Faculty are looking to generalize information. They're looking not at where we have local issues to cover, but we have to get better at selling it as case studies, as pilots. We do publish almost out of everything, almost out of all the projects that we have, but staff, faculty have to see that, and they don't. It's not tenurable, generally. Fidelity of treatment and replication, people are going to leave the room here, we think is a myth. We really do. We have had, but there's ways to do parts of it. But it is a myth, as you students in the room read about. To apply it in the real world, we had a CCDP RFP, request for proposal, Comprehensive Child Development Program, CCDP, 100 pages to follow to create a program. You would think that's pretty detailed. We followed it, and we were as different as could be from any other project that was funded in the country at that time. Okay, then we were different from the neighbor, from the other 15 programs. Within Allegheny County, implementing that, families were different from each other. How could you say, and we could debate this, but not today, please, what kind of fidelity of treatment is that? What kind of social worker will put you into a control group knowing that the intervention is probably going to use? What's the real life, real world issue there? Implementation we see as the first step towards replication. And if you poorly implement a great program, you have a really bad program. So implementation is key, and there are things that facilitate the implementation of programs. We say there are non-negotiables. So we pull out of a successful program that has evidence, and we pull out what you cannot change. But these programs don't travel well. How do you move it into another neighborhood and another organization? You have different leaders, you have different families, move it to another country? Are you kidding? So we're saying there are non-negotiables that you're going to have to keep. Family support's an example. Families are key. Look at the strengths of families, principles that you don't violate, but modify for the context it's in. Okay, sustainability is very important to us. As I said before, there were neighborhoods that would not let the university in 30 years ago. We believe sustainability has to be there for communities and agencies to want to continue to work. So to accomplish some sustainability, we ask that every program has advisory boards made up of stakeholders who can sustain that program, who would have interest in advocating for the program, possibly fundraising, and that's another issue. The second part is budgets. Not to go so far over budget that it is impossible to maintain that program in the future. When the grant is over and you're stepping out the door, the successes should be maintained. So what we do generally is sit with an organization, talk about budgets, talk about who's funding them. If it's government, is it likely to go up, or are you going to be losing money? How do we staff it so that it can be maintained in the future? Then we do other things like train the trainer so that that continues on once we're out the door, and manualizing it, having guidance manuals and documenting how it was accomplished. No, that's not me. But everyone in the room has felt this way at some point. So the second part of lessons learned in scholarship is that the community is a messy laboratory. Nothing goes the way you expect it to go, so don't expect it to go that way. Just get over it. Random assignment and no treatment comparison group. As I said before, what good social worker is going to put a needy family into a program in the control group that's going to get nothing? How are you not going to get contamination when the neighbors are talking to other neighbors as to what programs they've picked up and what they're doing and what the accessibility is and what the benefits are? Why would the family not go to that? Those things are important. Now, we do other things to make that work, and including in participant dropout. We now know we have other statistical measures that will help in that, and HLM would be one, or incentives. We are certain to get incentives to get the participants to stay in there, but it still doesn't always work. And this is the part I said I would get to. Here are other challenges, and this is the challenge of university community engagement. As I said, we gave up the idea early on, 30, maybe 29 years ago, of getting faculty to work along with the community on issues important to the community. Granted, now there are a lot more applied people, and the faculty, I have to say for ADP, are fabulous, and psychology too, interested in community issues. It has changed a lot in 30 years, but early on it was extremely difficult. Staff had to move quickly, had to be able to drop everything I just finished saying, and be there when needed. So no, we did not hire pirates, sorry Bob, pirates and musicians or hippies and princesses, although some people would not agree with me there, but we did not hire them, but we fought with HR. We got threats, we got HR people and past supervisors going over our heads to fight why we would hire certain people. In addition, their salaries were not always a match. Typically, people coming in from the community were making more than our HR would allow us to hire. It still happens now. We have staff that I feel are underpaid, and they could go elsewhere, but they're dedicated, and we're just so appreciative. Indirect costs. The university is not accustomed to us not getting the full indirect costs. We have in the past gotten the 48% or whatever from the federal government. Then we went off campus, so even federal grants don't give us that 26% or whatever to being adjacent rather than on campus. But a lot of our sponsors aren't used to giving us indirect costs, but they are accustomed to paying for direct costs. So as a university engagement unit, we then have to put rent in there, and we have to put furniture in there, and we have to put utilities in there if we're going to pay for them. So they will pay for that, but typically in what is the traditional grant coming in the door to a university, you get that from indirect costs. We do not, usually. And then I referred to this part before. We're really behind on this one. How do you assess scholarly activities, the kind the Office of Child Development does, where there's a difference in lives? We improve lives, we save lives, we improve family environments. How do you assess that? Yes, we do publish in peer-reviewed journals, but that's not our priority. If we can do it, we do it because we hit another audience. But we have to publish in practitioner journals too, and where people will read it who will use this information, as well as grants. They're not always federal grants, and as I said, don't bring in indirect costs, aren't for research only. So we really need a lot of work on this to keep moving forward. Okay, challenges to overcome, and then I'm going to get to challenges to understand. Again, you're not going to be happy with me on this one. And this is an extreme stereotyping of thinking, but as I said, we survey people, we go around the world and work with academics and community people. This is what we've experienced, and this is what we hear. So I put it under overcoming these attitudes. This side is what the community thinks about this side. And yes, a lot of people in the community, you may not find this embodied in one person, but a lot of people in the community think of academics as feeling awfully good about themselves. But they're so irrelevant, and they don't get the importance of what's going on out here in the real world. They're not trustworthy because all they want to do is get a publication out of this. So this is what they're coming in with. On the other side, academics say, why don't they read the literature? They'd have the answer to that. And why don't they do other work that is not so emotional? Why don't they hear what we're saying to them? And therefore, we get to a lack of understanding of why that happens. Purposes and working conditions of each group are quite different. Again, an extreme stereotype, and a lot from the first 20 years or so, and in the last 10 years, faculty, especially the ones I know of ADP, have changed so much. But the community is there to improve a particular group they're working with. That's what they're paid to do. That's what they're committed to do. That's what they're passionate about. They're there to provide services. They're tired. I'm not saying faculty are not tired, but they have intense caseloads and psychological issues that if you are working with an adolescent who is near to committing suicide and it happens, what do you go home with? I mean, it is intense. On the other side, the academic world is there to contribute to general knowledge, and yes, thank goodness, there's a group dedicated to doing that. It's there to research and publish, typically working independently, and trying hard to be unbiased. In addition, the community has many stakeholders. They have the kids they're working with, their parents, their board of directors, the government who's breathing down their neck, the other sponsors who are contributing other resources to them. They have a lot of legal, financial, and policy restrictions. They have mandated services that by law they have to fund, even though they love what the academics walking in the door with. That idea would be fabulous. Yes, I want to do that. No, I don't have money to do that. I have to do this first. And if I don't get mandated services funded, I don't have a system or an institution. That comes first. Academics have less relationships nowadays more than when we started, that's for sure. But the relationships are up to them and sometimes more formal with their funders and others. They have to adhere to the principles of scientific rigor and good scholarship, or they won't get more money, they won't keep their jobs, they won't publish. So why should we go through all of this? And yes, this is my youngest, Nick. Nick, who is really sick today from what I hear. But anyway, the impact on children, the outcomes. Remember back to the first slide on attitude, process, and outcomes. Outcomes are why we're all here, but they're different for a community university engagement center, but very important all around. So I'm going to start with traditional academic outcomes. Just so you don't think we don't belong in a university setting, we do this. We publish, whether they're books, academic chapters, articles in peer-reviewed areas, and we do presentations. Over the years, we do them locally, nationally, and internationally. And I really mean we. Everybody at the Office of Child Development is doing that. It doesn't matter at what level, what rank, what position. And over the years, we have raised $250 million with a B, dollars, much more so if we count what has gone out to community agencies. So, this is the traditional academic. We are taping this, so Valerie will see this and know that this happens. Poor timing. Maybe we actually paid someone to do that, but. Okay, and what's the result? There's one of my others trying to get through one of our monographs, and he is smart, but having trouble. This one sat through the practice presentation I had for today. So, could you all kind of stretch if you need to and carry on? So that's my James and my Mia, my two oldest. Okay, this is my favorite part because it shows human impact. This is what's going On to this day, all of these are still around, and that's why I thought they were important to highlight. This is not all that we work on. We have many other projects. But they came in the door in different ways, and I know a lot of you wanted to know, so how do we do this? How does OCD do it? How do other units do it? I could talk about OCD. So the Alliance for Infants, which is near and dear to my heart, and representatives, raise your hand. Okay, so the Alliance for Infants was happening, or it was started, actually, Ray Firth, who's on this side, had been my boss long before. And he heard while I was working on my dissertations, for those of you who are students, on my dissertation, and I was interested in low birth weight infants and children with disabilities. He had heard that from me over and over. I moved on to the University of Pittsburgh, and he called one day and said, you know that idea? He said, there's money if you could get the groups to work together. Children's Hospital, Allegheny General Hospital, McGee Hospital. Get those early intervention people to work together. There were many of those that don't exist now or have a different name. Get them to work together on this kind of issue. So, a year or two later, this collaboration that OCD led was funded. 5 years later, we spun it off the way we were supposed to if we ever pulled groups together. Remember that slide on facilitation versus operation? We were to facilitate and get out. Well, it took us 5 or 6 years to get out of the Alliance, which is still running now. 5 years after being with it, it was at 1,000 referrals per year. A couple of years later, 1,200. Last year, 5,000 referrals. The improvement in the lives of 5,000, and actually that year, 6,300 families. The children were the target, but the improvement in their parents' and siblings' lives, in their grandparents, this is really key. This is what OCD is about. Next, Healthy Start. Walked in the door quite differently. Bob Nelkin, one more time in my life, and Marge Petruska called and said, black infant mortality is horrible in this region. And we have been trying to get a proposal pulled together, and there's 3 weeks left. And there's things going on, politics and this and that. And that was when Bob Nelkin was a political entity back then. And he said, you gotta do it. I said, we don't know a thing about black infant mortality. He said, you gotta do it. I said, can't do it. It's a Friday afternoon. What are we gonna do? I'll give you whatever you want. It was a Thursday. I'll give you whatever you want. Well, we need content people. We don't know anything about this content. Okay, fine. Calls the health department. They set up a room for the next morning, 9 a.m. We get together, walk in. The room is full of people who are content people. Everyone knows Tanner. And we put it together, and he said, okay, it was done. It was the right thing to do. It's needed in this area. We're never going to get it. And then a notice a few months later, we're on the short list. Oh my God. Now who's going to do it? We weren't supposed to get it. So as it came in the door, again, we're not in that content area. This was so politically charged. And what we did was then work with, I guess it was the county commissioner's office and the attorneys there to set up a new 501c3 we kept it for the first year as we were supposed to start things and spin them off. We kept it for 1 year. Made sure there was a board of directors, hired the new director who was an African-American physician, wonderful at what she did. And it went on, it is still here. And to this day, you could see, supporting over 15,000 families. I can't say how many babies in those. And we see they have documented a steady decrease in infant mortality and low birth weight in the communities that are Healthy Start communities. Human impact. That's what we say is OCD's value and intent. Family support coming in the door differently, evolving from the CCDP program I mentioned to you, and early Head Start and others. Currently, there's 28 programs strategically in high-risk areas. Annually, 3,000 children and their families are served. And the findings from a couple of years ago of an external evaluation is that the initial investigation rates of child abuse and neglect are lower there, and that it is definitely decreasing in communities that have family support centers compared to those that do not. This is important work. Healthy Child came in the door much differently. There was a competitor out there that we went after grants, and they get it, we get it. They get it, we get it. Then we were actually partnering on some things over time. And then finally, Steve Bagnato and I said, why don't we work together? And so yes, that's ECP, Early Childhood Partnerships, led by Steve Bagnato out of Children's Hospital years ago. Around 2010 or 11-ish, it was integrated into the Office of Child Development. The biggest program within that unit is Healthy Child, and you can see here Healthy Child in a lot of different environments now. When it was envisioned, it was support to teachers and families at the preschool level. Over time, it was expanded to work with infants and toddlers. Elementary school, evidence-based programming was added to it, and now, this year, it is expanded to K-3. So we see that over the years, at least 45,000 children and families were impacted by this work. Okay, STARS TA. And yes, one of my grandchildren's hidden in there with his best friend Avery, and they get into trouble all the time. Hi there. This is Kevin Hart, and Verna Hart, for those of you who are students here, is my advisor. Yeah, long time ago. How's she doing? Oh, you're representing her today. She's fabulous. I use the stuff that she's taught me and that she taught me years ago, especially when we get into the international work, over and over and over. So be kind to your advisors. Okay, so STARS TA, another program, and let me start moving a little more quickly. We're almost done here. Has been around for quite a while, since 2004. It is actually in 11 counties, not 5, and it does 70 child care sites. It comes in 2 areas: improving quality of child care, as well as doing the early childhood mental health consultation, where it has 80 children from those 11 counties over the years. And the intent of that part is to reduce suspension, expulsion, and exclusion of children at that early age. Again, very important work, and it has done highest quality and has been awarded for that. So Early Head Start, our oldest program that came out of CCDP, is very important to our office as well. It is a federal program that has been around for a long time, about the longest we have. So it was created when we were working with about 140, expanded to 170 children, and now we have about 300 annually, and it gets top reviews by the monitors out of the federal government every year that we are monitored. Remember, we said we don't keep programs within OCD that are not service demonstrations, but this program over these years has demonstrated a lot of unique areas, especially in early childhood mental health services and trying out new things. And this is our youngest, this is our baby, and Isha's here, Medina's not. But this is PRIDE, Positive Racial Identity Development and Early Childhood Education. It is critical in this day and age, and always was, but it was recognized by a group of our staff who are working along with Q staff and the seed labs that Shannon oversees. And it was funded by a small endowment that we have within the Office of Child Development to take a look at what are the needs of very young children, African American children. And we found there's needs. Parents didn't know how to talk to their children about their identity, how beautiful they are, how wonderful their background is. Teachers didn't know how to do this kind of thing. So it's a relatively new area, but in 1 year's time, you can see the impact already in the numbers here. But it's a lot more that I couldn't put up here in numbers in terms of children, family, teachers, staff who are benefiting from this program. It's basically core funded by Kellogg for $1 million, but there are other funders, Opportunity Fund and others who are contributing, Hillman and that. And what I love most, maybe not most, but as much, is that our office staff are going through this training. It is very sensitive, it's very emotional. We acknowledge as white people, we don't know what we're talking about, we don't know how to talk about it, and we have to be very open and transparent in order to benefit from this. It's hard work, but it's so needed, and we appreciate that we are one of the first groups to get this training. Let me just see. Okay, the last two are groups, categories of type of work we do. This one we call ERT, Evaluation Research Team, and this whole area is overseen by Shannon Wanless from our ADP. And you can see the variety of programs that are impacted. And so this shows that we do not do young children only. We do homelessness, we do teen pregnancy, we do youth programs, college savings program. These are evaluations in general. And we do it across communities all over, mostly Western Pennsylvania. So, over the years, there have been hundreds of research and evaluation programs, on the average 20 per year, that one area of OCD is responsible for. So, I'm going to move on here. This last piece is what many of you might have already heard from in Bob's talk last December on orphanage work. And the last piece is one that he and I have been directly working on for over 20 years. It has taken us away from the Office of Child Development, but because of strong leaders within the office, like Tracy and Lori and Shannon and Bob Nelkin and others and Ray Firth, who were with us. I shouldn't have started with names because I see everybody. Janelle traveled with us, Stephanie traveled with us, and John Lay led up a lot of the work in China and other places. So it is near and dear to us. We don't know if it could be sustained, but what Bob McCall focused on is the work in Russia, because that is the core of our international work. We created and designed an intervention that would make institutions more family-like. Oh, and I forgot Bob Nelkin was in Russia looking at these things as well. So trying to make family-like institutions meant that we were combining groups and taking groups apart. making them smaller in number, but integrating kids with disabilities and integrating by age, so it would be more family-like. I used to always tell the staff of these institutions, how many of you had 12 kids all born to you at one time? Is that why you put all the 2-year-olds in one room and you have 12 or 15 of them? Is that a family? How does that work? So we did that. We did other integration. We created the environment of these smaller groups, and then we also trained the women who are taking care of the children to be more responsive, to pick up their cues, and to talk with them more. And you'll just see a very quick clip of this intervention in Russia, and then it relates to other countries we've worked in. The quick clip will show you before the intervention and after. It's less than 2 minutes, so hang in there. We tried to show the best of what was going on before. So there was other things going on. You could see lack of talking, everyone's in a hurry, overworked people, kind women though, I have to say, not knowing what to do with children with disabilities, and doing their day-to-day required tasks without talking, without smiling, without feeling good about themselves. A lot of depression, a lot of anxiety. They really took to this intervention. You could see the change after 1 year of an intervention, where children with disabilities were positioned and handled properly, as Bernard taught me. They were talking, they were social. They expected responses from their caregivers. They were happier, it was obvious. And then all our numbers showed the kids with most disabilities and most involved did fabulous in this intervention. We had women of all ages, sizes, and philosophies on the ground talking and sitting with the children. So you could see then that we've been able to take that intervention, and even though in other countries sometimes we just evaluated what was going on, as in China and in 2 countries in Latin America, it was evaluated on the standards of these evaluations that we did in Russia. The findings we have in the monograph at SRCD and in some other journals to show that it made a world of difference in the outcomes of the children. And we went back 6 years later without the intervention. So remember my talk about sustaining it. It was sustained. The children are doing just as well. And now we know, and now we're in Kazakhstan doing very similar work for a little bit different purpose. That country wants to deinstitutionalize. They want to close down their orphanages. So we are promoting that by training the caregivers and to modify their behaviors so that the children can be adopted with less problems or fostered with less problems. And we're also training the physicians and the psychologists who are called when there's an issue in the adoptive or foster care home, so that they know how to help the families as well, and they eventually want to close those. When we did a lot of the work in November, went back in February, and in that short time, 3 institutions had already changed their environment and had trained their own staff with train-the-trainer methods we had given them. So that was the good news there. And we can't measure the impact completely because it's not up to us, but we do know that there's tens of thousands of children being affected by that intervention. We know that because the Russian parliament has made it a law that every institution in Russia has to use this intervention. Okay, implementation's not so great, but our colleagues are those who have been put on the monitoring groups, and those teams go into the institutions and rank them and give them technical assistance. They're in 90 institutions there, and as I said, we have documented and published results from Russia, Latin America, China, and now we're working in Kazakhstan and hope to have some documentation for that as well. So that's the work, that's what OCD has been doing. I want to thank you all one more time. I want to tell you again, thank you so much. You've done so much to make my last 31 years fabulous. And nobody could have had a better job, I don't believe. I want you to take a look at people who have supported this in so many different ways, who are still around to help, who understand the work we're doing, and we'll keep it moving, I believe, forward. These are the countries, these are the parties, these are our lives together with the staff. And last but not least, I do thank Bob McCall for all the support and being a wonderful partner over these 31 years. The end.